Okay, today we are going to talk about the profession of athletic training and how it fits into the role of sports medicine. Okay, so here we have an umbrella with two sides. This is going to encompass that sports medicine is really an umbrella term that represents so many different fields. So on the left-hand side, we have performance enhancement, which includes professions such as exercise physiology, maybe sports psychology and nutritionists, and then our coaches and our fitness trainers. Whereas on the right, we have the medical side of sports medicine, which is where athletic training falls. So this is all about injury care and injury management. So this would be physicians, physician assistants, athletic trainers, physical therapists, sports massage therapy, sports dentistry, and really any small medical profession within athletics. Okay, so we have to understand the roles of a coach within sports medicine. So coaches have the responsibility to understand the limits of what they can do in an emergency situation. So they can usually help a healthcare provider, but they're not allowed to function as a healthcare provider. So what that means is that they are certified in basic CPR and first aid, meaning they can assist a healthcare provider, but they are not certified as a first responder or professional rescuer CPR first aid. So there is a difference there. So they cannot also give medical advice or healthcare advice because they are not a licensed medical or healthcare provider. Okay, so what exactly is athletic training? Specifically, it targets the prevention and treatment of all sorts of athletic related injuries. So that could be something as minor as a sprained ankle, something as major as internal bleeding or a kidney contusion, concussions, large lacerations. It really encompasses any sort of injury that could be obtained during some sort of exercise or athletic activity. So athletic training is practiced by solely athletic trainers. We're the only ones that can practice it. We are healthcare professionals who collaborate with physicians and optimize activity and participation of our patients and clients. So ATC, if you see that abbreviation, that stands for Certified Athletic Trainer. And we are board certified healthcare professionals, so we are licensed and certified in the United States, and we have to pass our board exams just like a lot of other medical professionals. All right, so our proper title is athletic trainer or AT. That's because we often get called trainer, which is very offensive, and it just doesn't mean the same term. It's a completely different profession. So it's not good to call an athletic trainer a trainer because they are not first responders. They don't have their master's degree in healthcare or medical fields. They're not a part of the healthcare profession. And it's also just confusing to other athletes or parents, and especially the doctors too. If they hear trainer, they're not going to take us seriously. But if they know we're an AT or athletic trainer, then they know that we're on par with every other medical profession and that we're board certified. So if you see an athletic trainer, if you're an athlete with us, please refer to them as AT or athletic trainer, just so that there's no confusion there. Some of our job duties on a day-to-day basis are going to be physical therapy and rehabilitation services. So this probably takes up the majority of our day, rehabbing our athletes and making sure that they're getting back to their pre-injury status. We can prevent, diagnose, and treat and rehabilitate injuries, whether they are acute or chronic. So again, any of those injuries that I listed, we are qualified to treat. We also provide emergency care. So we are first responders on the sideline of any sort of game or sporting event, meaning we are the first responders that will do CPR, first aid. We can spine board an athlete. We do the cognitive assessments, concussion assessments, all of that. We're the first ones there. And then we coordinate long-term care with physicians and other healthcare professionals. So if an athlete needs surgery, we set them up with an orthopedic surgeon. If they need x-rays, MRIs, any sort of testing, then we facilitate all of that care. So we really are a part of a really wide network of healthcare professionals. All right, some of the classes and routes that you have to take to become a certified athletic trainer. Most of the undergraduate classes are going to be kinesiology, biomechanics, and then as you get into your athletic training program, which is a master's degree, you start taking evaluation courses, learning how to evaluate injuries. You take more advanced exercise physiology. You take a class about modalities, medical terminology, a lot of the similar classes to the nursing degree or going into the medical field. And then we branch off into courses that a lot of physical therapists take, but it's tailored a little bit more toward athletics and emergency care as well. You do need a master's degree to become an athletic trainer. So what a lot of our students do is they take our sports medicine classes and then they transfer to a 4-year school and get a major in a related field like kinesiology or sports medicine, and then they get accepted into a master's degree athletic training program. And then after that, you have to become NATA board certified. That means you have to pass your board exams with the National Athletic Trainers Association. And then you can also go on to a doctorate degree. It's not necessary, but you can if you want to be a director of an athletic training program. All right, so these are just a few pictures of our facility. This is where we treat and house all of our athletes and all of our equipment. So on the left, we have treatment tables with some modalities between each table. And on the right, we have first aid center, ice machine, and our taping tables. So these are modalities. A modality is any sort of device that can help with therapy or rehabilitation. So we have machines like a Game Ready, which is a way to use cryotherapy to ice down an injury. We have ultrasound machines, we have electrical stimulation or e-stim, and we also have a laser machine as well. This is a portion of our physical therapy or rehabilitation clinic within our athletic training facility. We can do any rehab exercises that our athletes might need, so we don't really need to refer out athletes to any sort of physical therapy clinic unless there's something very specific that a surgeon wants. But after any sort of injury, we do all of the rehabilitation for our athletes in-house. So we're kind of a one-stop shop from the very beginning of an injury all the way through their rehabilitation protocol and back to return to play for them. If you're interested in athletic training, this is good to get experience with us here, take our courses because we are a community college, and that looks really good transferring into a 4-year curriculum. And then from there, you can get letters of recommendation and apply to a master's degree in athletic training. Okay, so different job settings for an athletic trainer. The most traditional setting would be an AT at a school. So this would be a high school, a college, or even further on into professional athletics. When you're at a school setting, you are usually working around the athletes' practice schedules and their classes, and it's usually from early in the morning to late in the evening or nights if they have night games. You can work in a physical therapy office, and this would be more if you're only focused on the rehabilitation aspect. You can work in a hospital or a physician's office. This has a lot to do with patient care, doing the examinations and evaluations for doctors. You can do wellness or exercise testing. You can work within professional athletics. So this would be similar to college athletics. You're just working with one team instead. You can work at fitness or training centers as the medical professional, research or biomechanical analysis if you're interested in research. And then you can also work in the industrial setting, which is fire, military, police. There are lots of companies and organizations that hire athletic trainers to help prevent and treat the injuries that they see on the job. These are just a few pictures of different job settings within athletic training. And then these are just some qualities about if you will enjoy athletic training. You definitely do not have to have all of these, but it definitely helps. So being caring and compassionate, anyone that goes into the healthcare or medical professions should have these. It's good to be strong in your science courses, able to stay calm under pressure, and then being able to tolerate different attitudes of coaches and players when they're upset after an injury. And then it helps to have an athletic background. It's not necessary, but it can help you in the beginning learning all of the different positions and rules and timings of a game, because part of your job is working in the emergency setting. That way you can understand when you can run out on the field, who to talk to, how many reps there are. It just really helps with the consistency of care with athletic training. Some of the pros and cons. Personally, I think there are a lot more pros than cons. It's a very fun job because everyone is usually lighthearted and excited for what they do. You get to enjoy the success of the athletes and teams when they're doing well. Athletes will appreciate you because they know you're a part of the team helping them be able to live out their goal or their dream. I like being outside. You get to go through different sports venues throughout the day. You get to travel to other schools and places. And then I like sports, so I get to work around sports and athletes all day. Cons is that there can be a lot of upset athletes after they're injured. You do work a lot of long hours, so nights, holidays, and weekends are very normal because it's any time that there's a sporting event. It can be lots of travel and hard on you with lots of elements outside. So if it's raining, the states that it snows in, that can be pretty tough. And then you can also deal with intense coaches or, losing attitudes that can kind of put a damper on the environment. An average day for an athletic trainer usually depends on which evening games there are that night. So if you have a football game at 7 p.m., you won't be done until, after 10 o'clock. So it really differs every day. So you might arrive around between 8 and 10 a.m., depending on the night games. You can do all your paperwork. Athletes start coming in for rehab or evaluation of new injuries. Then team practices start. They start practicing for a few hours, and they'll do their treatment, taping, and then you will be out on the field making sure you're monitoring all of the activity. And then 4 or 5 p.m. post-practice treatments for all of the sports. Then you will start setting up for your evening games right around then. So say there's a home volleyball game at 6, we set up between 5 and 5:30, making sure athletes are all stretched out, taped, done their rehab, and ready to go. And then until about 9 o'clock, cover the games for injuries, and then clean up and finally depart for home. So that's just an average day for an athletic trainer. Again, part of the job that I like is that it differs every day and you're not just sitting down at the same desk from 9 to 5. So I think it's a plus that there's so much variation within the field.